hospital officials here were really worried that one hospital was not going to be enough for a city as big as Yakima.
I'm not going to talk specifically about numbers because those change day to day and frankly, hour by hour, but situationally, generally on the ground, what's been happening?
So the number of cases is rising every day, and like you said, every hour, and that's pretty much happening everywhere. Health officials are not saying that this is slowing down yet, and quite the opposite. They're saying that April is going to be the worst month for a lot of these places. Um, and But it's important to note that that's not affecting every place equally. It seems that the pandemic is really concentrating in certain areas of Eastern Washington. And one interesting measure of that, if you do allow me to get into one number, is the percentage of positive tests that come back to counties. Statewide, tests have been coming back. Around 9% of tests are coming back positive, but that's a lot higher in places like Yakima County and in Benton and Franklin counties, where the Tri-Cities is. They report back 17% of tests that are coming back positive. And that's a lot higher than in a place like Spokane and even in King County. So that does mean that it seems the pandemic is concentrated in Yakima and the Tri-Cities. But it also means that testing is concentrated on vulnerable populations because resources are limited. And so these places want to get ahead of the pandemic and know how many people who are vulnerable to COVID-19 are affected.
There are two things of note for the Yakima area recently. The hospital that formerly closed, run by Astria Health, that is now reopened under state and federal guidance. Is that just out of an abundance of caution, or is that a perceived future need for things to get worse? Like, what really is behind the hospital reopening?
The Astria Regional Medical Center, it closed down in January. And even then, before we even knew what COVID-19 was here or in China or anywhere, hospital officials here were really worried that one hospital was not going to be enough for a city as big as Yakima. And so when COVID-19 began showing up in Yakima County, health officials were even more concerned. In fact, the remaining hospital, the officials there asked people to stay home even before the governor or the health district put in stay-at-home orders. And they said that by the 8th of April, that hospital was at risk of being completely overwhelmed with COVID-19 cases. So yes, health officials are saying that things are going to get worse in the coming weeks, but now because of these federal resources, they feel that they are much more prepared for that peak, which in Yakima County, they're expecting in late April. But that doesn't mean we're out of the woods yet. One huge need that we're seeing nationally and across the world is the need for personal protective equipment, and Yakima is no different.
You can read more about these and other topics at our website, NWPB.org. Thank you for joining us, and stay home, stay healthy out there in the unique Northwest.